Yeah, welcome. Thanks to you all for being here. My name is Aaron, and I'm the director of NAMI Juneau, and I'm with my coworker Meryl. And what we wanted to do is put together a series of presentations for mental health minded employees in Juneau, people who touch on the topic of mental health in some way in their jobs, and fill you all with some information about different facets of that work. And so this is a first of a series. I think we have 6 in the series, 5, 6, seems like 6. And this is just kind of a general overview of services in town and the resources that are available and some of the ways that we can help you all navigate resources. Then the rest dive into various topics that Meryl will touch on a little bit more later on in this presentation. And so just a couple housekeeping things. If you all have questions as we go, feel free to chime in. You can either unmute yourself or type it into the chat box. That would be great. And I think if you're so inclined, if you all want to introduce yourselves in the chat, that would be great. So folks know who they're in here with, if you're into that kind of thing. And other than that, we'll get going. Meryl, do you want to introduce yourself and what you do specifically here?
Sure. Thank you, Aaron. Thanks everyone for coming today. My name is Meryl. My pronouns are they, them, and I work at NAMI Juneau as the program coordinator. So I coordinate a lot of our support groups and classes that we're going to talk about a little bit today. I also facilitate a support group for AWARE called Spectrum, which is a LGBTQ trauma support group, which I also will talk about a little bit more later. And if folks in the chat, if you want to just put your name and your pronouns, and if you're coming with a certain job or from a certain agency that you want us to know about, that would be great, as well as if you have any questions or specific things you want us to touch on today, that would be great. We want to make sure we mention some things of interest to everyone here. So thanks for coming.
So I think the number one thing that we want to share with folks about NAMI Juneau in particular is that we help people navigate mental health services in Juneau. And like we do a lot of stuff ourselves. And I feel like if we could share one message, it's like call us if you have questions about how to find services, and then we can mention our things to folks as appropriate. I think maybe the less generous way of thinking about it is that we think of ourselves as mental health gossips a little bit. So like what's going on, who's doing what, and then this presentation is a part of us feeling the responsibility to share that info with the rest of the community. So people get in touch with us over phone, email, and they'll call and they'll ask questions about what's available. We get phone calls from people saying like, hey, I just moved to Juneau and I don't have a prescriber. We get phone calls from people saying, you know, I'm looking for support groups. I stopped receiving services at one place and I don't know if I can find services elsewhere. A lot of phone calls from family members of someone who's struggling and asking about what they can do to support their loved one. And but we want to always be available for those phone calls. So if you have folks that have questions about mental health services, or you have questions about like how to get folks from point A to wherever they want their point B to be, feel free to call us. We're not here. We try to be here 40 hours a week. That's probably not realistic. We have some flexible schedules, but we do respond quickly to both voicemails and emails that come into us. So we have a phone number, we have an email address, and all that stuff's listed on our website. And we actually have 2 websites. So one is namijuneau.org, and that's really information about what we do. It's when you go to the homepage, there's a calendar of all of our events, and you'll see our support groups, our classes, and our presentations on there. For the support groups, we have support groups for people to talk about their own mental health. We have those both in person and virtually. The in-person ones are Wednesday evenings. The virtual ones are kind of scattered throughout the month. And we have classes, or sorry, the other support group we have is for people supporting a loved one's mental health. So it's a lot of parents or spouses who show up because someone they love is struggling and they want to share resources and have someone just to relate to. because it's a difficult job, and having somebody to relate to is nice, feels good. So we have these support groups that we do. And again, that information is on our website. We also have classes. Meryl, can you speak a second about our classes, please?
Yeah, for sure. So we offer a couple of the NAMI sort of branded curriculum classes throughout the year. The two that we primarily offer right now is we offer peer-to-peer. Peer-to-peer just started, so we are still accepting folks. If there are folks that want to join, that's information's on our website and all our social medias. Peer-to-peer is basically an 8-week class where peers, so folks living with mental illness who have been trained to teach the class, spend 8 weeks teaching sort of about different coping skills, goal setting, and just kind of also connecting with each other. So it's a peer-based class, free, 8 weeks. And then we do family to family is the other kind of NAMI branded class that we do every year. We'll offer that again in the spring in April. And that class is really for family members who are supporting a loved one living with a mental health condition. And it talks both a lot about just kind of learning about what mental illness is, again, from peers. So the people who teach that class are family members themselves. And then it also talks about like how to communicate with a loved one with a mental health condition. Like how do you connect and yeah, just like be a supportive person. And that is also free. And we do it twice a week for a month. So it's kind of a condensed class. And that information's all up on the website too.
And so Meryl mentioned that our classes are led by people who, for whom that topic applies. So our peer-to-peer class is led by somebody who's addressing their own mental health. And our family-to-family class is led by family members who are supporting another loved one's mental health. And our support groups are similar, where our support groups are led by people who qualify for the group, right? It's peer-led. And that peer-led quality is kind of the bedrock of what we do. Like I'm somebody who addresses his own mental health in my day-to-day life, and I'm an employee here, and I feel like that peer-led aspect of our work is important and unique, and it fills a specific role in the mental health world. Like it's different than treatment. Peer support can augment treatment, but it is its own separate, special, helpful thing. Being around other people who can relate feels good. Sharing tips with other people who've experienced the thing feels good. So our support groups, again, like led by peers, classes led by peers. And we really want to support the peer support community in Juneau. And there's like the informal peer support, like what we do is informal peer support, right? Like we don't have any, you don't need to have any special license or certification to facilitate one of our groups or lead one of our classes. We ask that you become familiar with the material, and we have some like trainings to do, but it's not like a license or anything like that. But there is an official state license for peer support. It's a peer support specialist certification. It requires a 40-hour class and some paperwork, and then you can be licensed as a peer support specialist. And being a licensed peer support specialist allows you to get some jobs. Like JAMI has some peer support specialists. The hospital, I believe, is getting ready to hire peer support specialists when the new BOPS building is open. I might be wrong about that. I think Kira is on and could correct me on that one. But in general, peer support is growing. I anticipate more provider organizations employing peer support specialists as a part of the treatment team. And so one thing that we can offer is that week-long peer support specialist certification training. So we plan on offering it this winter. We haven't scheduled it yet. I'm a facilitator of that training, and we have a couple other community members who have been trained as facilitators. We've done 3 rounds of it already in the past year and a half. I think we have 15 people who are now credentialed in town, something like that, at least through our process, and other folks who are credentialed as peer support specialists also in town. And Michelle, I see your little paw up. Do you have a question?
Yeah, so the Wednesday night support group, is that the same as the peer-to-peer, or are those different?
Peer-to-peer is a class. It started last week, but you can still sign up and join. It's an 8-week class. So it's like linear, point A to point B. You're signing up and you're going to all 8 classes. 8, right? Not 6. I always botch this. Yeah, 8 classes. The support group, the connection support group, is a drop-in. So you're not signing up for any specific amount of time. It's not necessarily the same people each week. I would say we have a pool of like 10 to 15 regulars, and 7 or 8 of them show up on any given week, something like that. And other folks come and go. So the Wednesday night support group is different.
Okay. Where
I
the
think-
peer to same people, the same consistent group of people.
Yeah.
Okay.
Yeah.
But they're not like a T for T. They're not learning to lead a group. They're actually getting support.
Yeah, and so the idea of peer-to-peer is just you're with other people who share an interest in helping to learning to better manage your own mental health, and you're learning skills for yourself to use. So
Okay.
it's a class to learn.
Okay. That started last week, but you're still taking new folks.
Yep. And
Thank
then
you.
the connection support group, it's drop in, you're not obligated to do anything, and it's folks chatting. So it's very similar. I think anyone who's familiar with Alcoholics Anonymous or Narcotics Anonymous would find a lot of similarities where you
Okay.
show up, you chat for an hour and a half. It's a semi-structured conversation, but we ultimately want to make it meaningful for the folks who are there. So, folks are invited to talk about whatever's going on in their lives. And that's it. And some folks come back, weekly forever, and some folks show up a couple times and decide that they got what they wanted out of it.
So it's
So
what time is it on Wednesday nights?
Wednesday nights, it's 5:30 to 7. And it's at our office. Our office for the next 2 months is at the Mendenhall Mall in the annex. So when you're looking at the building, all the way to the right of Nugget Outfitters, there's a State Farm sign over a door. You walk in that door and we're down the hall on the left.
And people can just show up, or do they have to sign up?
Yep, people can show up. There is no register beforehand.
Okay.
They're free to, I think some folks, it's goofy to show up at something like this for the first time. I'm facilitating this week. We have a rotating group of people who facilitate. I think I'm facilitating again in a couple weeks. And so I always think it's helpful when I chat with somebody new about it. I love chatting about it on the phone or email or whatever, however the person contacts us. And it's also nice to be able to say like, hey, I'm facilitating this week, so I'll be the person that greets you at the door.
Okay.
I'll probably bring my dog this week, which is hopefully an
Nice.
extra draw for some folks. So I think if you do have somebody in mind who would benefit, this would be a good week for them to call and ask questions if they wanted to, or just show up. Because again, like I like describing it and introducing the idea to people, because it is anxiety provoking to show up in an unfamiliar place and spill your guts to strangers. We've had a lot of folks who say like, oh, I sat in the parking lot for 20 minutes and I finally got up the nerve to come in. And I do think most people, I would say a very large percentage of people, you can't promise 100% satisfaction, but I think most people walk out of there feeling better than they did beforehand.
Okay. Thank you.
And I think I can describe it in detail to somebody so that they can get a better sense of whether they would be one of the people who walk out feeling better. So peer support specialist training. I think that's what I was talking about. And again, that's something like if that's relevant to your workplace, you think that you all might be hiring certified peer support specialists, people with that piece of paper from the state. I am peer support specialist trainer, and we have a couple other folks in town that we know and are buds with who are trainers as well. So we can help set up a class to get people trained as peer support specialists. And Alaska Behavioral Health also has online classes that are accessible throughout the state if folks want like evening and weekends. Normally we would do like 9 to 5, Monday through Friday, get folks credentials as quickly as possible, but that schedule is not accessible to everyone. So for people who want something over Zoom or want it in the evenings or want it on weekends, Alaska Behavioral Health offers that. I think next we want to talk about financial support. There's a couple types of financial support that are available in Juneau. So we just want to make sure you all are aware of them. Meryl, can you talk about mini grants a little bit, please?
Yeah, so we work with a program. So we work with the Alaska Mental Health Trust, and I'll put the link in the chat in a minute, to provide what they call mental health mini grants. And so we are able to provide, we're able to apply basically for 3 of these mini grants a month. They're for up to $2,500. Usually they're used to cover household goods, sometimes furniture or beds, sometimes something like a gym membership. Essentially, all a person has to do in order to be eligible for this is have a diagnosis, some sort of mental health diagnosis, and be working with a provider who can write them a letter of support saying they need these items to support their mental health treatment plan. So we apply for up to those 3 of those a month. And we also just want other agencies to consider participating in this program, and I'll put the link in the chat in a minute. Our wait list is just always ends up being months out, and so it's a really great program in the sense that like it is able to get money to just like purchase things that are sometimes otherwise difficult to get covered. Like sometimes you can, participate in programs for housing support, but like buying your pots and pans or buying your bed or buying your winter coat can be more difficult to find funding to cover. So it's through the Alaska Mental Health Trust, and that's how we do it. And it just would be great for other orgs to do it as well. I know JAMI does it and a couple other places, but the wait list just gets so long. It'd be great to have other places that were also participating. If you wanted to add anything else to that, Aaron.
Yeah, so a mini grant can be up to $2,500, which is awesome. And we're really limited in town by how many we can offer. Like we as an organization can only offer 3 a month. Our wait list is huge. JAMI offers 3 a month because that's just how many the trust allows them to offer. I think St. Vincent de Paul offers mini grants, but we don't have a lot of organizations that offer mental health mini grants. So I like to tell you all that this resource exists, but it's also limited by how many we're allowed to submit each month. So like Meryl said, if any other organization can start providing them, is willing to start providing them, it's an awesome thing to be able to say like, hey, yeah, we can get you some household goods, $2,000 worth of car repairs, household goods, 2,500, excuse me, car repairs, household goods. It's just a really helpful thing to offer. And so hopefully we can find some more folks who are able to process mini grants. And then the other financial support that we wanted to mention to you all is that Clinton HIDA has some emergency funds. So I'm going to copy and paste the email address of Monica Wofford. Monica is the person who processes emergency funds through Clinton HIDA. So it's eligible for tribal citizens only. If you're a tribal citizen of Central Council of Clinton HIDA, you can receive these emergency funds. And the criteria is pretty broad. And so I think what I've heard Monica say multiple times is that if someone is in a tough spot, they can contact her for some emergency, meaning like, today, next day, two days from now, like within the next couple days, can receive some emergency funds to pay for housing and clothing and like crisis type things, something that you need immediately because something difficult has happened in your life. So Monica's email address, I just put it in the chat box. She can chat with you in any particular situation. You can give her the specifics of a situation, but Monica is able to offer some emergency financial support for folks. Worth knowing. And Teal, thank you for letting us know that that the Glory Hall processes 3 mini grants a month. That's great. I didn't know that. And we have folks who come to our groups and classes from the Glory Hall and people who call us about mini grants from the Glory Hall. So good to know there's some crossover there. So if our line is longer, maybe they can get theirs through you and vice versa. So thanks for letting us know. I skipped around a little bit, went out of order. So I'm going to go back to our services and show our website for just a second here. So this is the NAMI Juneau website. Again, I don't want to go through the whole thing. That's not the most entertaining presentation that exists. But I really wanted to show you all that the homepage of our website has a calendar. So you can see our support group is every Wednesday, Connection Support Group. Our online family support group is kind of scattered throughout the month. And also our workshops and one-off presentations are on here. So we did a trans student workshop at Thunder Mountain High School on November 1st and a JDHS trans student workshop on Wednesday, November 2nd. We have Inside Passages number 2, which is about trauma stewardship and preventing burnout on Tuesday, the 29th. We have a poetry workshop the evening of that day. So we have this calendar. It's kept up to date on our website, and it can tell you all of our stuff. We also have some flyers that give more information about our events. So you can see our Inside Passages flyer and suicide loss survivors luncheon that's happening on Saturday. So you have both this calendar and then the flyers with more information on them down below the calendar. Want to make sure you all are aware of that. So again, this is mostly to promote our stuff. So the calendar has our stuff. You can go to the pop downs to find more information about our classes like peer-to-peer, peer support specialists, and our support groups. We also have Juneau Mental Health. And this is something that we want to create as a separate resource because it's not promoting what we do, it's promoting the things that exist in the community. It serves a slightly different purpose. I think I have some complicated, vague feelings about why it's important to have a separate website to show all the community stuff instead of just having it on our website. So this is what we have. We have juneaumentalhealth.org, and we tried to make it a one-stop shop for understanding what mental health services are in Juneau. And the thing that people go to the most by far is the list of therapists. So I'm going to pull that up on the screen right now. We're at juneaumentalhealth.org. I hovered over Juneau Mental Health providers and I clicked on therapists. I think like 90% of folks who come to this website go to this listing. And just as you would expect, it's a list of therapists. It's in alphabetical order. Help her is first. And we see whether Dorlin is accepting new clients, whether she's doing telehealth services, who she serves, whether she specializes in serving veterans, what her modality is, what she accepts as payment, and some other comments. We have this format repeated for everybody on here. And what a relevant question to be asked, how often is this updated? We send out emails, mass emails to everyone 3 times a year, maybe 2-3 times a year. And you can, we get a response from some folks, not from others. So you can see Dorlin's was last updated August of last year, not very current. Catherine, I'll bet you is more current, updated February 22nd. We just got another round of responses from folks last week that we haven't entered on here yet. So some folks will be updated as of November 2022 soon. Then updated May of this year. So you can see when it was updated to see how reliable it is. I think we have something like 40 thereabouts people listed on here. Yeah, it's a relevant resource. We get a lot of questions from people looking for individual private practice therapists, and that's who's on here. We're currently changing it. We have a volunteer who's more tech savvy than us as staff that are, who is making this searchable. So you can search by whether the person is accepting new clients and whether they do telehealth and whether they work with adults or youth and a couple other variables. So we hope to have it searchable in the next couple of weeks here, which I think will make it much less unwieldy, or much more wieldy is maybe the better way to say that. We also have a list of prescribers, so under psychiatrists, and we have far fewer prescribers in towns. And, looks like 3. And those are private practice psychiatrists. We also have psychiatrists who are employed by some of our provider organizations, and then psychologists. So not like psychologists who are doing talk therapy, but psychologists who are available to do neuropsych testing. So Diane is first listed here, and we have a couple others as well. So again, like this provider list is the most commonly used part of this website. And then we also have a list of support groups on here. Meryl, would you mind sharing your screen and walking us through that list of support groups, please?
Yeah, absolutely. And Kira did share in the chat that the information on the BOPS page is out of date. So if you're going to the BOPS page right now, maybe wait a little while for it to be up to date soon. Which is great. Thank you for letting us know. Definitely part of why it's helpful for us to talk about some of these resources is because sometimes things change and we don't know. And so it's not a very helpful website if things are out of date. So if you do see things today as well that are incorrect, please let us know so we can fix it. These support groups, so the support groups tab here on juneaumentalhealth.org, really we're trying to just have support groups in this area that are free and are either drop-in or have a very minimal intake process. So like there is a ton of groups that JAMI offers. In order to access those, you have to be a JAMI client, and they're like treatment groups, which is different than being able to just drop into one of the NAMI support groups, drop into an A or NA group. So we just wanted a area where all of those are in one spot. So a couple of them worth knowing is just that the AA and NA websites are actually like shockingly up to date all the time. So this is a great resource for anyone who is looking for recovery support. And that's just this first link here. You have the link to ours. You have a link to a couple of the other support groups in town. I'm going to talk about Spectrum and some of Margie Thompson's groups in a minute. So I think I'll hold off on that. And then we have a couple, we try to keep these local, but AKITA, which is the Alaska Eating Disorder Alliance, I think is the acronym, offers quite a few virtual statewide eating disorder support groups. And so those aren't local to Juneau, but they are a great resource. And there's often a lack of access to supports for folks who are experiencing eating disorders and their families locally. So that's why that's included on this list. But we're always looking for things to add to this list. So if you're aware of other support groups that are free and drop in, we definitely would love to add them. And again, a lot of these are also in more of the peer support realm as well. And yes, I can remove nurturing parenting. Thank you.
And the last piece of that website that we wanted to highlight are the service matrices. The service matrices, and get out of here. Service matrices look like this. NAMI Juneau's been making these for a long time. And they show the provider organizations that do specific things. So this is the adults mental health service matrix. There's also a youth mental health service matrix and a substance use service matrix. We don't need to go through all three. I just kind of want to give you all a gist of these so you can figure out if, when, and how they might be useful to you. We have different categories of services on each. You see each little column here is a different category. So these are the organizations that do screenings and assessments. These are the places and organizations that do individual, group, and family therapy, case management, supported employment, recovery supports, crisis assessment, specialized services, med management, residential treatment. So who does all of these things in the realm of adult mental health? And on the second page of it, we have contact information, website, phone, email. So what we want you to know about a couple things here, a couple things that are new, updated, that not everyone in our community knows about. And the first is Clinton-Haida Community Behavioral Services Healing Center. So you see that listed here under screening and assessment. It's also listed under individual therapy, case management, and a couple other places. But Clinton-Haida now has outpatient mental health services for tribal members, tribal citizens. And there is an intake process, pretty straightforward intake process for people who want this service, people who are tribal citizens. So I'm going to share the link for you all. I'm going to put it in here. This is the link to make an appointment to engage with Klinkenheide Community and Behavioral Services Healing Center. They have therapy, they have outpatient individual therapy. They have talking circles, which is, again, more of a support service than traditional individual treatment with a therapist. And it's a new resource. It's free for tribal members, so it's worth knowing about. We've ended up referring quite a few folks to that service. Bartlett also has a few new things going. I'll share some of Kira's words with you all, and Kira, you can feel free to either chime in or type in or whatever you prefer, but BOPS is accepting patients for psychiatry that can be referred to therapy by a psychiatric provider. So BOPS has psychiatric openings. BOPS also has the new building that's set to be completed this spring, pending any delays. And the focus of the project is going to be crisis stabilization, but it's also going to house all of the behavioral health services other than rainforest recovery. So that new building that we have going on alongside Egan is going to be BOPS building with all of the BOPS stuff happening in it and new crisis stabilization services. Bartlett also has a new crisis and community intervention service. This is for folks who are in a more immediate mental health crisis, who can be connected to community navigators, sometimes referred to as the housing navigators that are housed at Bartlett, and outreach for individual family therapy, care coordination. And it's kind of, the idea is that it's short-term crisis care, 6 to 8 weeks, that connects people with longer-term care, either through BOPS or JAMI or whatever makes sense for the individual. So it's a crisis service, and you normally get a call that day or the next day. And there is a referral form if you're an organization that has spoken with Anna at Bartlett. And Anna's email address, I just put into the chat box. So like, we'll get a phone call from someone who will say that they lost their housing and they got out of residential care a couple weeks ago, and they don't have a therapist in town, so they're stuck. They're in a spot, and that's just one example of somebody who's appropriate for the crisis and community intervention services. So because I have spoken with Anna at Bartlett, we've talked about how criteria for referrals and the process. I then can refer that person, if they want to be referred, to the crisis and community intervention service offered by Bartlett. And they'll give that person a call back that day or the next day and connect them with services if it makes sense, if that's what the person wants. So Anna's email address is in here, aclindgren@bartletthospital.org. And she'd be a great person to talk to if you think you have folks that would benefit from being referred to that service. So step one would be to talk with Anna, and step two would be to refer the people for whom a referral makes sense.
If I could add to that for you, Aaron.
Sure.
Just on Anna's behalf with crisis, thinking with that particular program, acute crisis within the last 6 months, not chronic. Keeping that in mind, how well connected are they already to services? We don't want to be duplicating services, creating any barriers financially, double billing, or we're not into sheep stealing and all that kind of stuff. So keeping that in mind, as well as making that connection with Anna to just better understand her flow. And just so too, a lot of our folks that don't quite meet criteria for the mental health unit that come in through the emergency department, we are also referring to Anna's team if they are appropriate. And both teams have navigators, the crisis team and then the quote unquote former housing team. So they each have some intensive case management support there. BOPS itself is not right now, but we do sometimes get a little assistance from them as well. And we do have here at BOPS pretty quick psychiatric availability right now.
Awesome. Thank you, Kira. I appreciate it.
Yeah.
And then I have one more update from the greater Bartlett world from Rainforest Recovery. They want me to let you all know that masking is now optional. They no longer require PCR testing prior to admission, so they'll do an antigen test when somebody is admitted to Rainforest Recovery, but no COVID requirements prior to admission. And they continue to offer outpatient medication-assisted treatment services and therapy. And they've rolled out the outpatient DBT skills group for graduates of Rainforest Recovery with support and application of skills post-treatment. So Rainforest has loosened COVID restrictions and started offering some new programs, one of which the DBT skills group. I've heard folks already mention that a couple times just as I'm out about in the world. So great job on that one. We also wanted to mention, what did we want to mention? Let me look here. I think that's the stuff that we thought folks wouldn't know about what's new or different. So those are the two we really wanted to highlight. What's happening at Bartlett, what's happening at Clinton and Haida. But if any of you all who are on here working for a provider organization want to highlight anything else that is a service that is happening at your organization, this would be a great time to do so. And seeing none.
Hi,
yes.
Erin.
Hey,
Hi.
or go ahead.
I just want to make a plug for Front Street's new methadone opioid treatment program where we prescribe methadone for our patients who are struggling with opiate or heroin use disorder. So it's at the Front Street Clinic, and there's like a screening process. So you can just call our regular number and ask for that specifically.
And then how does the intake process work?
So there's like a screening. So basically is this a good fit? And then a patient will meet with a doctor for intake to get kind of a full picture of kind of what's going on, which is mainly medical clearance, because it is such a significant substance to use to treat opioid use disorder. But yeah, it's just straightforward, just like any other treatment program, with the added component of extra making sure medical stuff is in order.
And they get to talk to you and you're a pleasant person. That seems like a plus.
I actually am not working down there anymore, so I don't I don't do the assessments, but I'm happy to do a crisis appointment with anybody upstairs in our integrated clinic if they're not sure they want to go, and then I can take it from there. But yeah, I'm not down there anymore.
Well, thank you. I appreciate it.
Yes, thank you.
Mm-hmm. And so all that was just to say we have these service matrices. They're available. They're hopefully helpful, and it helps to define exactly what you're getting when you go to a different organization. And I know for us, we'll get a vague question of, I need mental health services, and the individual feels lost, and so about where to get those mental health services. And so when we drill down to all right, is medication relevant to you? Do you need a prescriber as a part of the services you're receiving? Does case management seem to be relevant? That can guide us towards the best place to refer someone. So we try to chat with folks long enough to understand exactly what services they're looking for, and those matrices are one way for you all to go about doing so when you're talking with folks in your day-to-day lives.
Yeah, something that I wanted to add, for those of you who aren't aware, we fortunately got a behavioral health clinician from Search in building here at the Glory Hall. So we have somebody here 40 hours a week. And we also have an outreach coordinator who's working primarily Mondays. So for people experiencing homelessness that need somebody to help them get to appointments and things like that, Kaya, our outreach coordinator, can help with that. And Piper is our in-house clinician. She's awesome. So.
That's awesome. Glad to hear. Thanks, Teal. I think we might have missed one part of juneaumentalhealth.org. So let's go back to that. Meryl, did you want to share your screen or just talk about it?
Yeah, I can share my screen. Sorry about that. So I just wanted to really quickly go through. So both on namijuneau.org and on juneaumentalhealth.org, we have a tab for LGBTQ resources. We also have these two little cards you see over here that say LGBTQ2+ local resources and national resources. We have those in like paper postcard size form and have been sharing those out in the community. If you would like some for wherever you are at, I'm happy to bring you some. Just throw that in the chat as well. But there's just a couple things that I wanted to highlight that are also new. So one of the things is that every month, and this is in partnership with the Zach Gordon Youth Center, it happens at the Zach Gordon Youth Center, Margie Thompson is offering a gender therapy group for youth. And so it's a therapeutic support group for youth, I think 12+, who maybe they're identifying as transgender at this point, or maybe they're just wanting to talk more about their gender, but that's happening every month. The screening process is very simple. You either talk to Ty at the Zach Gordon Youth Centers here, or you talk to Margie, and cost isn't an issue. So if young people don't have insurance they can use, don't want to use their insurance for safety reasons, can't afford it, it's fine, they can go for free. So that's just one of the newer things we wanted to make sure we mentioned. And I also just wanted folks generally to like know that these tabs exist, and you can also find on here, which we also made in partnership with the Zach Gordon Youth Center. We have resource guides for trans students in the middle schools and the high schools. So those are on both of the websites, as well as a webinar we did discussing the resource guide. So there's more there, and if you have questions about any of these resources, you're welcome to reach out to me. I'll put my email in the chat too, but just wanted folks to know that this was another newer aspect to our website, as well as some newer resources that are being provided.
Thank you, Meryl. And that makes me think of one other newish thing we're doing, also with Zach Gordon Youth Center, a sentence we've now said 5 times maybe in the past 5 minutes. But we're able to offer scholarships for gender affirming items for teenagers. And is that on our website, or is that just folks go through the Zach or Teen Health?
Yeah, so that's not specifically on our website, but it's in partnership with the Zach and with Teen Health. So any youth who goes to a staff person at the Zach Gordon Youth Center or at the Teen Health Center and requests a gender affirming item, whatever that might mean to them, then that staff person reaches out to us at NAMI and we will purchase the item. So it's just some flexible funding we have from doing fundraising to be able to provide those items. And we can do it where the item gets sent directly to the youth, or it can get sent to whichever staff person they're working at whichever agency. We can bring it to them at school, which we've done before. But it's definitely another program we're very excited about, and the youth have also been very excited about, so that's been great.
I think the last thing I wanted to talk about in terms of services is 988. So 988 was rolled out this summer, and I wanted to just give a little bit more information about it. So 988 is like a new number you dial on a phone, but it goes to an existing service. It goes to the Alaska Care Line as long as you're calling from a 907 number. So the actual service itself is the same. It's just 3 digits to get there instead of whatever a normal phone number is, 9 digits, 10 digits, 7 + 3, 10. And so you're still, when you call 988, you're going to the Alaska Care Line, and the Alaska Care Line still operates the same as it did before 988. So again, it's just an easier way to get to that service. And the Alaska Care Line is not just a crisis line, although it is a crisis line, but it's also a line that you can call when you don't like the way you feel. So they get a lot of phone calls from people who are sad, people who want to connect with somebody else, people who are depressed, people who are scared and confused. So I think 988 is not as often described as a service that you can call if you just want to talk to somebody. And so I want to make sure that you all are aware of that. It is also, though, a crisis line. So if you are suicidal or you're with somebody who is suicidal, it can be a resource for that. And it's a replacement for calling 911. Because the 911 response is police or fire department. Those are the 911 services. So 988, which is the care line, is more equipped to help deal with somebody who is suicidal. Their goal is de-escalation. Their goal is to work with the individual and get them in a better place. And the majority of the time that works. And there are some times where they will be speaking with an individual, and despite them, the staff person at the care line doing, their thing, their best, the individual remains suicidal. And I think it's also important for folks to know that the care line will then engage with emergency services, which is 911, which does end up being the police, if the person remains suicidal and the de-escalation that the care line folks use is not effective with that individual. So the care line says that it's between 1% and 2% of all calls end in a referral to emergency services, and they do not always tell the individual they've referred to emergency services when they do so. So I think it's helpful for folks to know when they are calling in a crisis, to know how the service works, to know that they are not going to call emergency services immediately, that their goal is to talk with you and get you feeling better just by virtue of that connection. But it is their policy to engage with emergency services if the caller remains suicidal. So I think that's important information for folks to have, so they can know if that's the best thing for them to use, the best tool for them to use when they are suicidal. For some folks, that's great. For some folks, it's not great. So again, we want people to have full information about the service. And that's what we stand on it. So that is 988.
Quick question about 988. So if our military folks are calling from a line that's not a 907, they'll just go to whatever that area code is?
Yeah, exactly. So, I have a 248 area code because I'm from Michigan. So I would go to whatever the Michigan version of it is. They all operate substantially similar. There's not a, I can't remember the phrase that was used. They'll have the same basic operating framework, but they do have some small differences at each call center. So I can't promise it is the exact same at every place across the country. If you're calling from 248 or 117 or whatever the 1,000 area codes are, but there's always some version of the person answering the call is responsible for carrying the call. They want to de-escalate on their own. Emergency services will be engaged with if the caller remains suicidal. And they think that emergency services, the person answering the phone believes that emergency services is the best way to address the situation. So yeah, they're all substantially similar. But the information I was giving was from a conversation and like the policies that were given to me from the care line, the Alaskan care line in particular.
Thank you.
Yep. So that's it. That's everything we wanted to share. I think Meryl is just going to speak for a second about the rest of Inside Passages, and then we'll stop recording. And if anyone wants to stick around and chat more, we'll stay on for another 10 minutes or so. But Meryl, you want to tell us about the rest of Inside Passages first?
Yeah, most folks probably already have seen this because you made it here today, but so this is the first of the 6 presentations that we're kind of doing through the spring, and so I just wanted folks to have a chance to see what is coming up. So in a couple weeks, Amelia Hanrahan is going to talk with us about trauma stewardship and preventing burnout. If you haven't had the pleasure of meeting Amelia yet, I would really recommend you come. She's a clinician who works at a middle school, and she has taught us at NAMI a lot about trauma stewardship, and has done some kind of like debriefing with us and has provided us with lots of resources that we've been using as we support other organizations that are supporting the mental health of their staff. So I am very excited for November 29th. Definitely suggest you all come to that. Akita is coming in January to talk about eating disorders, and up on our website, we'll have a little bit more information about exactly what they're going to talk about soon. In February, Charnel from the CBS Clinton-Heides Community and Behavioral Services Healing Center is going to come and talk about the ways that she kind of utilizes traditional Southeast and Tlingit values and practices into evidence-based therapy that she does. So if you are providing therapeutic care, I would highly recommend you join us for that, because I think it's going to be spectacular. In March, Margie Thompson is going to come and speak with us a bit about providing gender-affirming mental health care. And one of the things that she's going to touch on in that time is things like how to write letters for transgender folks who are seeking like gender-affirming surgery, who need documentation from their mental health providers in order to get access to surgery or hormones. So Margie's going to talk about some kind of skill building stuff for clinicians about that, as well as some other things, but that's one piece. And then in April, we're going to kind of end our series with lived experience panel. So Erin's going to be there. Karen Nelson, who's just a really spectacular speaker in the state who talks a lot about recovery and her experience with incarceration and addiction. And she's going to be joining us. And John Drips, who is one of our Connections support group facilitators, will be joining us for that. So come to whatever you like. Please share with your pals. And we're glad that you came today. I'm going to stop recording, and anyone who wants to stick around is welcome to.